Join the conversation with the Morning Majlis.
Thank you for hosting me. My life has been about how we can bring impact into the mainstream business and how we can move business away from sort of check writing and actually integrating workforce so that we can alleviate poverty. So, for example, I worked a long time in telecoms, so how could we help poorer people access the ability to sell telecom scratch cards, to work with what's called a public call office, very common in the Grameen phone model, where women could sell phone calls to women that couldn't afford a cell phone or credit, but could afford the call. So that has been what my work has been about, and I bring together government, business, and private sector so that they collaborate in alignment to bring these strategies to a fore.
Well,
very interesting.
Exactly. And, you've been working in Afghanistan. We mentioned this off air. Now, what was the main areas that you were focusing in Afghanistan in particular, and what brings you here to the UAE?
Terrific. So in Afghanistan, I helped set up the largest telecoms company there. And my role was very much to use technology for social good. So I did things like bringing M-Pesa, which is mobile banking, because banks can't afford bricks and mortar sort of buildings right across the country, but using a cell phone, you can provide access to people that earn $1 or $3 a day who couldn't be banked otherwise. I brought in e-learning, which meant that you could bring schooling to the rural parts of the world. I brought in telemedicine, which was a cheap, affordable, accessible way to give the general public that couldn't get access to a hospital or a doctor access to quality healthcare.
I want to just sort of press you on this a little bit more because it speaks a lot to my idealistic self, being able to work for far more than just a profit and to have that real impact that I think a lot of people do discuss. We've had Davos recently, and that, brought forth quite a few discussions about what impact are we actually making, especially as those who come from a wealthy or a privileged background. You speak a lot about telecommunications. Can this be replicated in other industries? How would you approach it?
Yes, I think absolutely. I think there are very few industries where this kind of model cannot be replicated. So, for example, what I do at the present time is I help address the issue of healthcare, affordable healthcare in the UAE. So like any part of the world, the UAE has sort of experienced great economic growth, and with that, a population rise, and with that, prosperity. And that has led to a rise in non-communicable diseases, cardiovascular diseases. There's something like 37 million people suffering from diabetes in the region, of which 800,000 are in the UAE.
Whoa.
Now, when you look at these stats, you look at something like diabetes or high blood pressure, basically uncontrolled, that leads to Alzheimer's and dementia. So you see how the unsustainable costs carry on. Now, if you could intercept with a model that captured this early on, you can actually reduce the number of incidences and also have a healthier population. So basically lifestyle, diet, exercise, monitoring. And today in the UAE, you've got great penetration of telecoms. Practically everybody has a mobile phone.
Or three.
Exactly. You've got great coverage everywhere. The UAE government has provided sort of free internet in many, many common places. And the government is fully committed to universal healthcare for everyone. That's quality, affordability, and accessibility.
Wow.
And I think that the big precursor and the exciting thing for me is the fact that the government has launched mandatory insurance, which means that the base of the pyramid, which is some 4 or 5 million people, can now have access to quality primary health care. And that is super important because that's the gateway to keeping people healthy. Now that, coupled with the fact that you've got wearables, monitoring technology, telemedicine, patient engagement models, leads you to a place where the government has recognized that it can leapfrog old ways of delivering healthcare. today everyone in the US and the UK is looking at how they can make cost savings, whereas the UAE is actually poised to leapfrog all of that and actually come up with a superior model that is more cost effective and gives you better outcomes and saves you money.
True. Well, we'll keep hold of that thought as well. We'll go take a bit of a short break and continue this. And where can we leapfrog from there? And what's coming up next here in the UAE? Stay tuned to the Morning Majlis.
Join the conversation with the Morning Majlis. Pulse 95.
Yes, you can join the conversation with the Morning Majlis. 4215 text lines are open, and you can also stream our content live on internet platforms and video platforms as well. Now, there's a key question because we've got Shainoor Khoja, who is a Chief Impact Officer, an entrepreneur, TEDx speaker, as we were discussing how can people be more impactful. We're talking health insurance that's been provided to the bottom of the pyramid, if you were to say that. Now, let's see where we can go from here. Now, we are discussing the importance of being impactful. Now, there's the growing trend of writing checkbooks. You know, you can pass on the checks, you can make the payments, say, oh, I've donated, I've contributed to the society. And there's profit-making corporations as well at one end. But what's the middle ground? We do understand millennials want to be a bit more impactful and want to have a say. But what are we seeing at the moment? Shainoor Khoja, spokesperson for making an impact in healthcare.
So thanks for that question. I think that one of the key issues that we face in the world is that we have private sector on one side, we have foundations, not-for-profit on the other side, and the government trying to bring everybody together. And I think that there is a willingness, because there is a real clear understanding that tomorrow's customers want to see impact, want to see responsible companies doing responsible things. I think one of the issues that we face is that there are very few people that really understand both sides, both mindsets, and very few people that speak the same language. You see, when you talk to private sector, you're talking about profits, bottom line, etc. When you're talking to not-for-profits, you're talking about outcomes, impact. And so you need to bring that common language together. And it is happening. But it's a little bit slow.
And it is this sort of preventative focus that we were talking about off air. And you talk about that language, the bottom line, the business case for things. There is a strong business case for this.
Yes, there is, absolutely. So if we go back to the base of the pyramid and healthcare, now in any country, as it grows, initially investment comes in where you can make most money from private sector. So that was the case in the UAE. A lot of investment at the top end. Fancy hospitals, state-of-the-art equipment. You want to have a kidney transplant, you can have it. You want cardiac surgery, you can have it. But very little at the base of the pyramid. The working class people, they either had over-the-counter treatment or they went to small clinics with one or two doctors who had to focus on a utilization model, and a curative model. So you went in and they did the plethora of tests, etc., and then prescribed a number of things. Now, what we are looking at in the UAE, because the opportunity presents itself, is that you can actually have a large player across this whole market and utilize economies of scale and utilize the technology that's available. So, for example, what we are doing at the moment, we have almost 800,000 lives under our care. And we have representation all across the UAE. What we are doing is bringing quality, affordable, accessible healthcare right down to the base of the pyramid, very close to where they live and work, so it's easy for them to access. There's no cost of travel, etc. We are using data at the back end to capture what diseases these individuals are suffering from and what the precursors are to it, so that we can actually address how we might treat them. And then within our processes, we're bringing in technologies to streamline electronic health records, billing, all of that, so that doctors and nurses are doing what they were trained to do. They're not pushing paper. And therefore, they're satisfied, they're bringing their best selves to work. And then on the front end, we've got patient engagement strategies, everything from health promotion to medicine reminders, prescription reminders, and then introducing very shortly telehealth to really make sure that, if you've got a common sort of complaint, you can get it sorted out very quickly and you don't have to take a half day off work. Why is this good? This is good because a healthy, productive workforce leads to a healthy, productive economy and, reduces the cost burden overall, but it requires a mind shift.
Wow. Okay. I mean, this touches on so many different points that we've discussed quite a lot here on the Morning Majlis. Digitization, technology and innovation, making sure that humans, come first and robots or AI or any of that data collection comes second and then helps us do our job. It is really fascinating to know that there are so many different layers.
Well, what we'll do is now, just very quickly, as we're about to conclude this conversation, if you were to say, where are we going with the health insurance scheme, and does investment really, how much investment is required to provide them with better healthcare? Because we do know that we have the base insurance covered, but more needs to be done.
Yeah, so I think that the real focus now has to be on preventative care and an investment where you actually align the government, the providers, the insurers, and the employers. You've got to bring them all together so that we're actually working towards one end, which is improving the healthcare of the base of the pyramid or the working population. If we do that, we will make the UAE an attractive place to come and live and work. If we do that, employers will find it easier to retain their employees. Providers, in order to do this, will have to work very hard to get paid to keep people healthy, what is called a capitation model in other parts of the world. But it's a very fantastic opportunity to get paid to keep people healthy.
True. Well, thank you very much to come on to the studio, Shainoor Khoja, who is a Chief Impact Officer, entrepreneur, and talking to us about how people can be more impactful and having the preventative model when it comes to health insurance and provision of healthcare here in the UAE. Stay tuned to the Morning Majlis.
Thank you.
You're listening to Pulse 95. 95. It's the Morning Majlis. Pulse 95.